close.
Yeah, because he's looking. There are a few people that are really like that. Okay. That's not Roger, you know.
No.
We'll see. Just see. Ladies in Florida.
Okay.
A couple are coming back with meetings. Some regulars. Welcome everybody, Health Info. Our guest speaker today is Jessica Carfagnini. She's going to speak about complementary cancer care, naturopathic medicine, nutrition, IV vitamins, and a host of other things.
Right, hey.
All right, thanks everyone. So I just want you all to feel comfortable asking questions at any time. Just, throw your hand in the air and get my attention. So I'm a naturopathic doctor, and I'll tell you a little bit more about what that entails, our training and all of that. Thunder Bay Naturopathic Clinic is where I practice. So this is just a little overview of what we're going to talk about tonight. I just have a few bits of information about the increasing incidence of cancer. We all know cancer's on the rise. I'm going to talk more about some naturopathic medicine's emerging role in cancer care. And I'll elaborate on how an integrative model is really what we're working towards, which means naturopathic care and mainstream oncology treatments are used together so that people are not choosing either or, they're choosing both and. Naturopathic treatment plans, we're going to talk a little bit about diet, exercise, stress reduction, traditional Chinese medicine, botanical medicine, and clinical nutrition. Those are the modalities that we work with as naturopathic doctors. And then I have a little bit of extra information on mistletoe therapy and intravenous therapies, which are really only available at our clinic in Thunder Bay. They haven't been available in Thunder Bay before that. Actually, Dr. Lynn Tintinelli, who was a naturopathic doctor who practiced here in Thunder Bay for 10 years, she did offer intravenous therapy at her clinic. So, but right now our clinic is the only place to get that. So these are just some very sobering statistics about the prevalence of cancer. So this is directly from the Canadian Cancer Society website. So this was a projected incidence that they did in 2013, looking at what they thought the 2014 numbers would be. And this is just Ontario. This is not all of Canada. So looking at almost 10,000 men diagnosed with prostate cancer, almost 5,000 with colorectal cancer, and an estimated 4,500 would be diagnosed with lung cancer. And the statistics for women are quite serious as well. So almost 10,000 to be diagnosed with breast cancer, 4,000, lunch cancer. That must have meant lung cancer. Sorry, I must have been typing this out when I was hungry. Yeah, it must have been. Wow, I actually succeeded in making people laugh at a presentation on cancer. There you go. And then also you see colorectal cancer numbers are pretty high in women as well. So naturopathic doctors, we attend 4 years of naturopathic medical school. So this is postgraduate, meaning we need to get an undergraduate degree first. So going to university, getting 3 to 4 years in really any discipline, but if you study in any discipline, you have to make sure you get your pre-medical sciences. So my undergraduate degree was in psychology. I had another career first. Then I went back to school to get my general chemistry, organic chemistry, biochemistry, physiology, all of that in order to then just start in naturopathic medical school. So it's a very comprehensive program, 10 to 11 courses in one semester. Yeah, I never knew I could work so hard. When I was in my undergraduate degree, I used to, before exams, I would study in this way that was very meticulous. I would read everything, I would make notes on everything, I would highlight all the course material. There were so many courses and exams in naturopathic college. There were some times where we were going into exams without having reread all of our notes from the lectures. So it's pretty high pressure. But the wonderful thing about it is there's so much material that you learn at naturopathic college. So my training entails all of the basic medical knowledge, that medical doctors are getting, like the anatomy, physiology, microbiology. We also get some training in pharmacology as well. Even though we don't prescribe pharmaceutical medications, we need to understand what they are and how they work in the body, because anything we prescribe, we have to make sure it's safe with any pharmaceuticals that our patients are on. So we do study pharmacology as well. And then at the same time, we're studying traditional Chinese medicine, botanical medicine, and we have 4 years worth of clinical nutrition. We study homeopathy as well. So it's a lot to keep up with, but there's a supportive environment at the Canadian College of Naturopathic Medicine. So. And then after that, we complete 1 week worth of rigorous licensing exams. And boy, am I glad that's over. So naturopathy has actually been a regulated profession in Ontario since 1925. Very few people know that because we're often seen as the new kids on the block, but naturopathic medicine has been around for a long time. Now in World War II, with the advances of advanced surgical techniques and the discovery of antibiotics, Western medicine, or mainstream medicine, really took off because those were amazing discoveries and they've helped us out so much with people's healthcare. But naturopathic medicine took a bit of a dive at that time, but ever since the 1970s has been making a comeback as people are demanding more for their healthcare, as they realize that we need more tools to keep ourselves and our families healthy. So our licensing is about to change. We're about to be our own self-regulated profession. So it's called the Naturopathy Act, which was written in 2007. Finally, it's going to be proclaimed by the Ontario government on June 1st. So you'll probably start hearing about that in the news closer to proclamation. And then we'll be regulated by the College of Naturopaths of Ontario. So it's good news. It offers more protection for the public, right? Just so that people know that when they're seeing a naturopathic doctor, that person is trained properly, licensed, and regulated. So a little bit about naturopathic cancer care. So all naturopathic doctors are qualified to give basic advice to anyone, and yet there are some naturopathic doctors who decide to specialize and work more with cancer, for example. So to become a naturopathic oncologist is a lot of work. Attaining that specialization, that's called FABNO, so Fellow of the American Board of Naturopathic Oncology. So it was created in the US by the ONCAP, the Oncology Association of Naturopathic Physicians. Basically what this involves is you must have been in practice for at least 5 years. You need to have seen a certain number of patients who are dealing with cancer. You need to have specific notes on all those cases, and then you need to do a lot of studying, and then you apply to write an exam. So as far as I know, there's only about 12 of these naturopathic oncologists in Canada, and there are more in the US. What's great about most of them is they're very dedicated to helping everybody else out. So I'm a part of I'm a member of the Oncology Association of Naturopathic Physicians, and it's such a great resource because what it means is if I have a case that I'm particularly, that I need some help with or just want to double check with my colleagues, I can send an email out and get feedback from naturopathic doctors with far more experience than I have. So there is extra training involved in terms of being able to deliver intravenous vitamin and mineral treatments. So I did my training to become IV certified right after I graduated. So I've been IV certified for a few years and doing more and more IVs all the time. I'll elaborate about IVs a bit more at the end. So some of the benefits of working with an ND, if you're dealing with a cancer diagnosis, are improved quality of life and fewer side effects from mainstream oncology treatment. So going through chemotherapy or radiation is very, very difficult, to say the least, and recovering from surgery is quite an ordeal as well. More so depending on the type of surgery, of course. And so what we offer in terms of our therapies is people can often withstand these therapies and get through, say, a full course of chemotherapy or radiation if they're also using naturopathic medicine to help their mind and their bodies stay strong through all of that. And there's lots of different examples for different things, such as people developing mouth sores. Glutamine powder dissolved in water is something that we will use for that. I'm also aware of honey being used. So just one little example. And naturopathic therapies help extend life in many cases. I've heard lots of wonderful stories about people who are living well and living years longer than they were expected to live. So people define statistics, which is always wonderful to hear. One of the other benefits is by working with a naturopathic doctor, you can avoid inappropriate use of natural therapies. So there's so much out there now in the world of natural products and supplements. And even I get overwhelmed sometimes just going into Kelly's Nutrition Center and like looking at the shelves. There's so much out there. And so having the guidance of a naturopathic doctor who's got all those years of education and all the other naturopathic doctors who are working in cancer at our fingertips, it's just helpful because we can do that work for you. Help you avoid anything that's dangerous. So there are certain drug and natural product interactions that can happen that can be dangerous. Certain herbs, for example, can potentiate the effect of a drug, so making the drug more powerful, more potent, or alternatively can decrease the effect of a drug. So you have to be careful about what you're taking. Some natural therapies can even interfere with chemotherapy. And then more often than not, what I see is people just wasting their money on ineffective natural therapies that aren't really doing anything. So it's good to get your money's worth when possible, right? So I want to tell you a little bit about the Ottawa Integrative Cancer Center. Now, I was very lucky to be able to spend a day there preceptoring. This was when I was already a practicing naturopathic doctor, but I spent a day there watching and learning and helping out in their IV suite and shadowing some appointments done by naturopathic oncologists. They have an amazing center. And they didn't open very long ago. I think it was only 2012 that they officially opened. And they are actually a branch of the Canadian College of Naturopathic Medicine. That's the school that trains most of the naturopathic doctors in Canada. And they're doing some amazing research in addition to providing great patient care. So they recently were awarded a grant for $3.87 million for an 11-year longitudinal study studying the effectiveness of naturopathic medicine in cancer care. So I really appreciate everything that they're doing, and I'm lucky enough to be able to check in with their doctors on a regular basis and to follow a lot of their protocols. So this is just some extra information about how this works. So they really are focused on the integrative care, and they have great relationships with the medical oncologists in Ottawa as well. So I love this quote because it's from one of the medical oncologists at the Ottawa Hospital. And she says, "For far too long, disciplines have worked in isolation without communication, and our patients have often felt caught between differing therapeutic philosophies, often to their detriment." And then she's talking about the OICC, the center itself. She said, "This is a wonderful initiative. An integrative program will help provide a much needed bridge." So it's really about all of the doctors, medical doctors and naturopathic doctors working together for the best outcomes for everyone. And this is a picture of some of the staff at the Ottawa Integrative Cancer Center. If you get a chance, check out their website. It's oicc.ca. They have some wonderful videos on their website too that are really well put together and provide a good overview of the amazing work they're doing. Okay, So before I go any farther, I just want to check in with everyone and see if there are any questions yet. Okay, yes?
Do you think the increase in cancer is because of the aging population? Is that part of it?
That'll be part of it. And then there are a lot of other theories about why. But yeah, I mean, we have such amazing advances in medicine that people are living longer. And if you live long enough, eventually you'll get cancer because that's just what will happen to your cells eventually. So, and there's also the idea that everyone has cancer cells in our bodies. It's just a question of whether they proliferate or whether our immune systems take care of them, right? That's another way of looking at it. So, so that's definitely one factor.
Are they called cancer cells when they're dormant?
Well,
Or
we
they
don't
call it
really
something
call them
else?
that because we don't necessarily know that they're there, right? So what sometimes they're called, so for example, with cervical dysplasia, right, you might have precancerous cells, or they're called atypical cells in the cervix. It's not called cervical cancer at that point, but by doing a pap smear, they can observe that the cells have changed. They're not malignant, but they
that
have
the same as
changes, they're
mutation?
atypical. Pardon?
Is that the same as mutation?
Possibly, I'm not sure of the exact definition. I don't want to say yes because I'm not a microbiologist, but there are all sorts of cellular changes that can happen in our bodies, and some of them are benign, and then some of them can accumulate and result in cancer. So yeah.
Is it true that if you keep your pH in proper shape, that cancer has a very slim chance of getting to you?
No, I address that later on, talking about the alkaline diet. And there's some truth to the idea that eating the diet known as the alkaline diet will benefit your health. Because, I mean, if you're eating an alkaline diet, what kind of foods are you eating?
Vegetables, green
Lots
matter.
and lots of veggies, right? So eating those vegetables is an amazing way to stay healthy. And it's because of the phytochemicals and all of the constituents of those vegetables. And we only understand the medicinal value of some of them, right? It's also the fiber, the roughage in the vegetables. So many things. The idea that it's keeping your pH in a certain zone, I have a hard time wrapping my head around that because from a physiological perspective, our pH differs in different parts of one body. I mean, never mind different bodies, right? But, you know, the pH in my stomach is supposed to be very acidic. That's the way my body's designed. The pH in my blood has to be between 7.35 and 7.45. And my body will do everything in its power to keep my blood in that pH range. That cannot be changed. That's how the blood is supposed to be. Now, there is some truth to looking at an alkaline diet in terms of bone health and avoiding osteoporosis, because your body will borrow minerals from your bones to buffer the blood. So, you know, to keep your bones strong, yeah, eat lots of vegetables, keep your diet alkaline. But there's just no way to test exactly, you know, looking at urine pH or saliva pH, it just doesn't bear out in terms of results. However, eating lots of vegetables does. There's lots of research on eating a plant-based whole foods diet and that being a health promoting thing. Not just in terms of avoiding cancer, but also lowering blood pressure, lowering cholesterol, lowering incidence of cardiovascular disease like heart attack and stroke. I mean, there are some general rules to living well, right? Eat your vegetables, eat some healthy protein, exercise. Those things bear out well in all of the research for pretty much most health conditions. So I'll talk a little bit more about some of the other diets that we hear about for cancer. Okay, so a naturopathic treatment plan will often include all of these, sometimes just a few of them. And we'll go into detail with them. So this is just what we were talking about, right? Anti-cancer diet. Lots of vegetables. So we know about all of our vitamins, right? Vitamin A, vitamin C, and then these are just some examples of places you can get them. Now, I just want to point out calcium. Many of us assume that we need dairy products to get our calcium, and that's not necessarily true. Sesame seeds are extremely high in calcium, so I'm often sharing tahini recipes with my patients. So tahini is sesame paste, and you can make some wonderful salad dressings and stir-fry sauces with that. Tahini is, you know, it's rich in protein and calcium, so it's a nice, easy way to get your calcium in. And then you also see kelp and almonds and watercress in there. And then vitamin D, of course, really important. So all these things, just looking at food as medicine.
Vitamin D3,
Pardon?
vitamin D3, D alone.
Yeah, D3 is the active form. And because we live in Thunder Bay, I generally recommend that everyone supplement with vitamin D3. We're just too far from the equator to get enough from sunlight, unfortunately.
And it's 1,000
The dose is different depending on each person.
Yeah.
I usually recommend about 2,000 IU a day as a general dose. But for cancer, sometimes we'll go all the way up to 10,000 a day, which sounds like a lot. Now there was probably somebody grabbed it, but there was just one sheet. It was a vitamin D. It's very colorful, and it's got, yes, that one. Let's pass that around so everyone can see. I only brought the one copy, which was silly. But this is a great chart because what it does is it shows you what your blood levels of vitamin D should be in order to avoid, to increase your chance of avoiding certain cancers or other problems. Osteoporosis is on there. It tells you the minimum amount to say, you know, avoid rickets, for example.
Every 85 pounds of body weight, 1,000 milligrams.
IU, you mean? 1,000 IU?
Yeah, sorry.
That would be a general idea, but that's still kind of a conservative dose. So most people can go higher and still use up that vitamin D. Yeah. Yes.
She mentioned D3, then you mentioned D. Are they interchangeable, or are they two different things?
D3 is the active form, and most supplements now are vitamin D3. So
What does that mean by active form? I'm not sure.
it's the form that your body can absorb and use, because there's other forms of vitamin D. There's a D2, but that's the one that you don't want to take. So, yeah.
Why do you mention flaxseed there? It's known as the most unbalanced of the essential fatty acids.
Unbalanced?
Well, it's
It's
way,
a great source of ALA, so it is one of the omega-3 fatty acids. Now, I don't recommend it to the exclusion of other fatty acids. I don't think that it's good as a single source. But flax seeds actually have a lot of benefits in addition to the essential fatty acids. Now, for a lot of my patients, I'm recommending fish oil as well, because you get the EPA and DHA. So those are important omega-3 fatty acids that reduce inflammation in the body. And I would say that EPA is the most important one.
Decided good?
That's the one with the most research.
what
So-
about hemp seed oil? That's supposed to be more balanced for human consumption.
Well, I'm not sure. I don't prescribe hemp seed oil a lot. It might have a little bit of omega-6 and a little bit of omega-3. Pardon?
Omega-6 is not too good.
Well, omega-6 is fine. We need omega-6, but the thing is, in North America, our diets tend to be overloaded with omega-6 and deficient in omega-3. It's different if you're in Japan and eating a traditional Japanese diet, right? So what I'm doing for each of my patients as I develop an individualized treatment plan is to get a sense of what their diet is lacking or where we might be able to help them by boosting up certain nutrients. So, I mean, fish oil it's one of our most commonly prescribed supplements because it's good for so many things. You know, prescribe it for memory, I prescribe it for pregnancy, it helps build that baby's brain, all sorts of things. It's not for the immune system, actually. It's an anti-inflammatory, so it helps with cardiovascular health and a lot of things. Good for brain function, too.
Isn't it important to have the fish oil from small fish?
Ideally, yeah, because then you're avoiding heavy metals and such as well. So, I mean, any fish oil that you get, just make sure that that it's from a high quality source. So, I mean, we carry the professional brands at our clinic, and those are all very healthy sources. Okay, so then here's some of these phytochemicals that are being studied as anti-cancer components of foods. So these are really interesting. So these agents can potentially stop cancer growth, prevent angiogenesis. So angiogenesis is the process by which cancer cells and tumors create new blood vessels to get more nutrients from the blood to feed themselves, right? That's angiogenesis. So there are certain cellular pathways that are being researched that shut down that process, so that prevent the tumor from creating more blood vessels to nourish itself. And then some of these cellular pathways look at even causing some cancer cell death. Because one of the problems with cancer cells is that they don't die normal deaths like every other cell in our bodies do. Healthy cells have a natural life cycle and they undergo apoptosis. And the immune system will tag certain cells to say, okay, this cell's no good anymore, it's time for that cell to die. Apoptosis is kind of like cellular suicide. So cancer cells, the apoptosis switch isn't working. They're not dying when they should. And so there are certain things that can turn those back on. So a lot of the research into natural therapies and some of the new research into pharmaceuticals for cancer are really looking at the molecular signaling and what's going on on this cellular level. So this is part of where we're going in the future. It's kind of exciting stuff. One of the things I love though about food, I mean here we're looking at ginger, camphor, fennel, carrots, red chilies, green tea. These are foods that have been around for hundreds if not thousands of years, more like thousands, right? And they have a long safety record, right? So turmeric, for example, it's that bright yellow spice that we see in curries. It's actually pretty mild, and I recommend people have it on their table along with their salt, their pepper. Have your shaker of turmeric and shake that on your food as much as possible.
And don't forget
And interestingly, it's better absorbed if it's heated with oil, and black pepper helps the absorption. So you're like, oh, you're describing a curry, okay. So I think there's wisdom in a lot of traditional diets and in a lot of foods that humans have been eating for a long time. So that's one of the reasons why I get really excited by anti-cancer foods. We have to eat 3 times a day at least. So let's make everything we put into our bodies benefit us, right? Is there a question over here? Yes.
It wrote earlier, potentially. That's kind of a soft word.
Yeah.
Do they help?
There's lots of different research studies out there, but in a lot of these research studies, it says potentially or may, and they're doing that because they might have some results that are in vitro, for example, where like in the Petri dish, those turmeric, that turmeric did kill off some cancer cells. It doesn't mean that happens in the human body, right? And so there's more and more human research coming out. But even with human research, the wording's always very cautious, right? And I don't want to give anyone the impression that any one thing I'm talking about today is a cure for cancer. There's no known cure for any specific cancer. What we have are treatments, right? We have treatments and we have things that we can do to create a terrain in the body that is an anti-cancer terrain, if you will. So, just like we know there are things that help cancer proliferate, right? We know that smoking is a huge, offers our bodies a lot of toxins. It helps cells to mutate and not be able to regenerate. So there's a lot of things we know now that we didn't know 50 years ago. And there's interesting studies. So just to talk a little bit about lycopene from tomatoes. So I read this one result of a study that looked at so men with prostate cancer. Lycopene is a big one for prostate cancer. And the way they administered the lycopene was simply in the tomato sauce on pizza. So literally pizza was the treatment in this study. Makes me laugh. And I'm not sure how long the study was, but you know, it was men with prostate cancer. They were randomized to be fairly equal. And the group of men who ate this pizza with red sauce for a certain number of weeks actually had a reduction in their PSA levels, which is a marker for prostate cancer. So it kind of gives you an idea of just how powerful the lycopene must be if you know, eating pizza can reduce your prostate cancer marker.
In the case of this, for tomatoes, it has to be cooked in there, is that correct?
That's
Not
correct.
fresh.
Yeah, it's in raw tomatoes, but it's activated by the cooking process. So tomato paste is a great source of lycopene. So yeah.
Is there anything else that has the lycopene in it other than tomatoes?
Tomatoes is the only source I know of. Yeah, because there's other red, you know, fruits and vegetables, but I haven't heard lycopene mentioned in conjunction with red peppers or berries. It's, you know, some of the purple things like berries, it's resveratrol we talk about. So yeah, resveratrol is on there too. There's lots of different things that we can talk about. Cruciferous vegetables and indole 3-carbinol is a powerful one. There's tons of research about you know, broccoli, kale, Brussels sprouts, cauliflower, that whole family, and how important those components are for fighting cancer. So some of my favorite books for looking at naturopathic approaches to cancer. This is one of them. I'll pass it around. Don't anybody take it home. I rely on this book quite a bit. So Lise Oshler is one of the authors of that book, and she is a naturopathic oncologist, or FABNO. She's also a survivor of cancer herself. She works in the U.S., and that's an excellent guide to cancer. She does say in there too that, you know, if you have cancer and you're reading this, that's great, but you know, please get yourself a naturopathic doctor as well, because it's hard to self-treat. And then there's another book called Anti-Cancer, A New Way of Life, which is a great one to read. It's by David Servan-Schreiber, and he's passed away now after he had brain cancer, I think must have been 3 times by the end of his life, but he had lived for decades, you know, with a brain cancer that, according to statistics, should have killed him within 1.5 years. He lived many extra decades, but unfortunately he's passed away now. But he left us with some amazing books, and one of them is called Anti-Cancer, A New Way of Life. If you go to his website too, I'm not sure of the exact address off the top of my head, but if you type in his name there, Servan-Schreiber and Anti-Cancer, he's got an excellent website that's been left up there. And that book has an anti-cancer action plan at the end of it, which is excellent. I photocopy it and give it out to all of my patients who are dealing with cancer. It outlines an anti-cancer shopping list, the anti-cancer dinner plate, what that should look like, and it's a great resource. Okay, so we talked a little bit about special diets. We already touched on the alkaline diet. Has anyone heard of a completely sugar-free diet to beat cancer? I know I've heard a lot about that one.
Impossible.
Yeah, I mean, it's true that cancer cells are greedily grabbing as much glucose from your blood as possible. But glucose is, that's one of the most simple sugar molecules, right? Your body needs glucose to survive. Your brain needs glucose to function. Your heart needs glucose to function. So it's impossible to completely take sugar out of your bloodstream, because no matter what you eat, your body will break it down to glucose. That's what your body's supposed to do. That's okay. But now eating refined sugar, you know, lots of cakes and pastries and candies and pop, that does create inflammation in the body because sugar it's empty calories. It can dysregulate your blood sugar. It can lead to problems with blood sugar balancing and insulin problems. It can lead to being overweight, which can increase risk of certain cancers. So there is wisdom in the idea of reducing or eliminating refined sugar, but I also think it's important to, have some quality of life. So if you want some dark chocolate or you want a little bit of, maple syrup in your tea, then by all means.
Isn't it best to omit fructose, glucose,
Yeah, fructose and glucose are examples of refined sugar. So, if you're looking at a juice box and you're trying to decide which one to drink, it's the 100% fruit juice that's safest for most people. Not necessarily for someone with diabetes, because even natural fruit juice can dysregulate blood sugar. But a lot of those fruit cocktail juice boxes, they've got fructose and glucose as their first ingredients. So that's just added sugar, that's all that is.
Doesn't fructose, isn't that natural in?
Yes, it does naturally occur in fruits, but if it's occurring naturally in a fruit, it's very different than when you actually read it on the label, when it's been added. So corn syrup, for example, is like
that's what
fructose, and that's, it's synthetic, right? It's been really highly refined. So it does originally come from nature, but it's so processed and so refined, it hits your bloodstream pretty hard.
So if I see something that says apple, then I could assume that there's natural fructose in there from the apple, but not any added fructose. It's just the stuff that came.
Yeah, so for example, if you're looking at applesauce, and it just says, apples, they probably add citric acid, that's fine. But some applesauces, it will say sugar, or it will say glucose, fructose, then they've added sugar in to make it sweeter. And it's amazing, I mean, why would you need applesauce to be any sweeter? It's actually pretty sweet already. So just be aware of that, because the more processed a food is, there's sugar in so many things. So I've become a relentless reader of ingredients everywhere I go. So, do you have a question?
Is it true that sugar cane, when they use it, is actually brown and they bleach it to be white for us?
That's a good question. I'm not sure.
I just heard that and I thought, they bleach it for us?
Yeah, I didn't know that.
But
Yeah.
Raw sugar is brown.
the sugar cane actually brown.
Well, I used to suck it in Indonesia, we cut off a bit of it, and then it's not brown, but the moment the air gets to it, like an apple,
Yes.
it gets brown.
Okay,
Oh,
I
that's
think that is true.
Because
To get it, they have to cut
Probably
it.
depends
So
on what
brown.
point you get it, right?
Yeah.
Yeah.
Oh, they bleach it, absolutely.
That would have helped me decades ago.
Also, beware of organic and natural products that you assume are healthy just because they have the word organic or natural on them. You still need to read the ingredients. A lot of them will have organic cane sugar as an ingredient, which it's still sugar. So if you're trying to reduce sugar in your diet, then you want to still avoid those products. It's best to really focus on a whole foods diet, which means nothing that comes in a box or a can if you can avoid it, right? Yeah, I mean, there's certain things you're gonna get in cans and jars, and that's okay. But really, we're talking about the perimeter of the grocery store, right? Produce and some grains, and looking at fish as well, and high-quality sources of protein. So yeah, the idea of taking sugar out of your diet to starve the cancer cells is never gonna be totally effective. So the ketogenic diet, that's only helpful in certain cancers. There's some research that shows it can be helpful with glioblastoma, for example, which is a brain tumor. So the other benefit of, so ketogenic diet, just so you know, is where you're on a very calorically restricted diet, so that your body is in a process of breaking down fat and releasing ketones. That's what ketogenic means. Now there's another thing too called intermittent fasting. So there's some interesting studies coming out showing that fasting before intravenous chemotherapy can actually reduce side effects of chemotherapy, because chemotherapy gets to all the cells in the body. We really just want it to focus on the cancer, but it obviously is going to affect other cells. So I forget the exact mechanism. I think it was something like by going into a ketogenic phase, so fat breakdown, because that's what happens if you're not putting food into your body for a certain period of time, is your body starts to break down fat in order to have glucose for the heart and brain and such. What happens is the cancer cells don't downregulate. They just continue to be ramped up, and so they're the ones who are exposed to the chemotherapy in the blood, because they've done the angiogenesis. They're trying to get as much from the blood as possible, whereas the other cells are just not uptaking as much from the blood, and so they're essentially slightly protected from the chemotherapy. I think that's the mechanism of action with fasting before chemotherapy. So I haven't yet recommended that to any of my patients because I just recently read a study about it, but it's just interesting because it's one of those things that it wouldn't cost you anything extra to do. It takes some willpower, but it's very natural too, right? Okay. Exercise. Now we all know how important exercise is for health in general. It's really important for helping the body fight off cancer as well. So we often think of doses where we're talking about food and about supplements, and how many capsules of this or how many spoonfuls of that. But we need to think about doses of exercise as well. So with exercise, doses are calculated in METs. So METs are metabolic equivalents. So 1 MET is the energy required to sit quietly for an hour. And there's all these research studies that show better results with certain numbers of METs. So women with breast cancer, for example, did much better, had increased survival time if they were getting more exercise. So 10 to 17 METs per week is what they were looking at for breast cancer, which only equals about 3 to 5 hours of walking. And that's spread out over a full week, right? So what you might be looking at there is, half an hour a day, for example.
That's hard to understand, because if 1 MET is sitting down for 1 hour, are you saying that 10 hours of sitting in a week would match my breast cancer?
Well, it does sound like that, doesn't it? I think the idea is that you do have to get going and get those METs in certain doses and in a certain amount of time. I have a handout here. So this is actually from the Anti-Cancer Action Book, and I'll pass it around so everyone can have a look. And I want to do more research in order to understand this better, because that is a very good question. But it gives you ideas of how many METs per activity, right? So they say, sitting, watching television, 1 MET. But you can't get, that's not exercise, right? Sitting and watching television all week.
No.
So yeah, here, I'll pass this around and everyone can have a look.
That's why I'm in such good
Did
shape.
everyone see the vitamin D
I don't think
handout?
pheromones are released in the house.
Make sure we pass that around. And there's so many other benefits to exercise as well. You've got decreased stress, happier mood, and actually exercise helps the body to detox as well, right? Because we know that some of the ways we detox are through our breath. So deep breathing, you breathe much more deeply when you exercise. And sweating is another great way to detox as well. Okay. So another important component of an anti-cancer treatment plan is looking at mindfulness and self-compassion. So there are connections between, emotions, old conflicts that are still causing strife, and past traumas that haven't been resolved. So there's a lot of benefit to learning to accept your emotions, including fear, sadness, despair, and anger, the emotions that are very difficult to face. and talking to someone about those emotions is very important. And it's different for everyone. Some people have a good friend they can talk to, others may prefer a minister or a therapist. It doesn't really matter who you talk to, as long as you are able to open up and be honest about your emotions. And then, of course, meditation and mindfulness. And from a research perspective, there's increasing research on the value of mindfulness-based meditation, and also mindfulness and self-compassion practices. So there's so much research now that, so I'm actually doing a course it's a therapeutics and prescribing course. So the main textbook for the course is this giant book put out by the Canadian Pharmacists Association. So I'm studying all the pharmaceutical medications and how they're prescribed for every condition you can possibly imagine. But in each chapter, for each disease or condition, there's a small paragraph for non-pharmaceutical interventions. And mindfulness-based meditation comes up more often than you think. And this is the book put out by the pharmacists. So we really need to take mindfulness practice seriously, because it has very real effects on the cells in our bodies. It has a very real effect on our physiology. So this is just a quick note on what we have available in terms of mindfulness practice at Thunder Bay Naturopathic Clinic. This past summer, we were really excited to have Dawn Blessing and Trudy Kurgan join our team. And so they offer individual counseling sessions. And the type of counseling they do is based on mindfulness and self-compassion. And actually, Dawn Blessing has offered 2 courses already that are mindfulness and self-compassion courses. Now, it's not a support group, it's actually a course where you learn these practices of mindfulness and how to incorporate them in your daily life. And it is paired with self-compassion, which is key, because has anyone here ever tried to meditate? I've tried, so a lot of people have tried, and maybe some of you have regular meditation practices. It's hard, it's really hard to meditate. And so what's easy to do is to slip into some negativity or feeling bad about yourself because you're not meditating right, or you're not able to clear your mind. You get kind of down on yourself. So that's why self-compassion is very well paired with the mindfulness, is because you can just be light with yourself and realize, you know what, it's the monkey mind. We are human, we have thoughts, that's normal. Has anyone read any books by Pema Chodron? She's out of Gampo Abbey in Nova Scotia. She's wonderful. She's been meditating for over 30 years. She's a Buddhist nun. And she said, oh yeah, my mind still wanders all the time. That's just what being human is. And so it's that levity that you're looking for, just to being easy on yourself. So Dawn actually has a course coming up, May 9th and 10th, if anyone's interested. It's a weekend intensive course. The other courses she ran were 6 weeks. It was every Monday evening for a month and a half. But this one is for people who are, they don't want to do a weekly thing in the summertime. They just want to, do the weekend course and have all those mindfulness tools at their disposal. So if you're interested in that course, you can call the clinic to find out more. You check out our website too. We have more information on the website. But I've heard wonderful feedback about that course from a lot of patients and also friends and family who take the course. Okay, so any other questions so far? Yes?
Yeah, you mentioned that if we live long enough, we'll all basically get cancer. There's children getting cancer all over the place, though.
I know.
So this evidently it's not an old age thing, and
No, it's
so
not
they're treating
an
these
old age
people.
thing.
Are they actually curing them, or are they just treating them and prolonging their life? Like they used to say that, well, after you made it 5 years, you were cured. Now you're saying you're just prolonging the life. You're not considered cured? Or how does that work?
The terminology of cured is a very difficult terminology to define. So I don't know what defines a cure, right? What my perception of it is that it's an optimistic thing to say, right? If you look at it from a, sort of pessimistic medical perspective, we're all going to die eventually of something, right? You can live a very healthy lifestyle. No one lives forever. So it's just a matter of what does your quality of life look like and how long can your life be? Or how long do you want it to be, right?
My mother had a mastectomy back in 1975, I guess it is, and she's 91 right now.
Wonderful.
She's still out shoveling snow, and she got hit by a truck and broke a leg and broke an arm, but she doesn't have any cancer, you know, so
Yeah,
that's just, they did no other treatment, they did no radiation, no chemotherapy, nothing back there. and
Yeah.
They took that breast off and she just ran away.
yeah.
And she
I
never
know.
went to a doctor for
My
like
grandmother
5,
was
6
87,
years.
and she had breast cancer scare over probably 30 years ago, and yeah, same thing. So, I mean, I don't want to give the impression that, you know, there's never any cure, but it's just, there are no guarantees, right? And you can have a cancer scare and you can have that be resolved. The thing about cancer too is that we talk about it like it's one disease, but it's not. It's thousands of different disease processes that have been grouped under the title of cancer because they all involve, you know, cells that are malignant or that have changed, right? But, you know, looking at pancreatic cancer versus breast cancer, those are two very, very different conditions. And even certain breast cancers can be very different from each other. So, yeah, I mean, that could lead us into a big philosophical conversation too, right?
Can you comment on electromagnetic radiation, like from your cell phone or from an electrical outlet?
Yeah, well,
I mean,
you know what?
Is there any science behind it that it's actually,
Causing cancer?
yeah,
Well, I haven't seen any convincing studies, but the thing is electromagnetic radiation hasn't been around for that long too, so I think we just don't know.
Isn't it coming from other sources like stars and the sun?
It is, but the way that we've harnessed it and used it in the past, you know,
Yeah.
30 to 40 years is very different. Right, our world has changed so fast, and I don't think we fully understand the ramifications of that yet.
Well, I keep my cell phone away from my head at night and put it on airport mode. I don't know, just in case.
Probably a good idea, yeah.
Yeah, just in case, but I'm just wondering if there's anything.
I mean, what we can say is that screens, you know, screen time before bed, whether it's TV or phone or computer, definitely affects your melatonin levels. And we know melatonin levels, if they're dysregulated, are connected to certain incidents of certain cancers. Because we know that there's increased incidence of certain cancers among shift workers. So, and that's where your melatonin becomes dysregulated. We use melatonin as a supplement to help with cancer care. So, I mean, if you look at it as something indirect in that way, yeah, definitely. But I mean, that's a big question, and
Yeah.
I don't have all the answers, but definitely keep an eye out for research about that, because I think we will see more research on that.
Do you think there's a good possibility of people like yourself or the naturopathic side of medicine to be hornswoggled into going with the big boys with the big money?
What do you mean?
Everybody knows what I mean.
Pharmaceutical drugs.
Well, I mean, then we would be medical doctors,
I
right?
noticed you
If we're
made a
prescribing
comment, you know,
pharmaceuticals?
you can treat cancer. Well, my little boy was dying and a nurse called me and said, oh, we can treat him, you know. Well, I can pour battery acid down my throat and give myself a treatment. It isn't necessarily a good one.
Yeah.
And that's exactly the analogy to use, because they're filling people with poison and trying to tell us that they're helping people. They aren't helping people at all. I wouldn't even rub shoulders with those people.
Well, it depends on the case. So,
But so many doctors were, like Hoxie and Gerson and so many of those people they were backed up by judges and all kinds of politics. Everybody was saying, yes, these people are curing cancer, you know, that are given up on by the medical profession, and yet it was all pushed down, you know. even Otto Warburg, remember in 1927, I guess he was twice Nobel Prize winning research scientist, proved the cause and prevention of cancer at a cellular level, you know, the deprivation of oxygen. But, you know, I think there's so much research out there. There's even one doctor up there talking, if you just type in baking soda cure, there's one doctor, I think it's from Germany now, and they've been using baking soda, and they're really having great, you know,
There's
cure.
a lot of interesting research out there. There are a lot of hoaxes out there too, and that's the challenging thing, is to sort through it all, because there's so much. I mean, it's good to use your critical thinking skills though, and ask a lot of questions, absolutely. So just back to this traditional Chinese medicine, very helpful. It's not going to cure cancer, but it can really do a lot of things. Decrease nausea, decrease anxiety, increase energy. And there are certain herbal formulas too that have great cancer fighting properties. Has anyone here heard about any kind of medicinal mushrooms being used for cancer, like reishi mushroom? And yeah, so there's a lot of interesting research into the mushrooms. So Coriolis is a mushroom that I've been prescribing to some of my patients with cancer. Coriolis, yeah, Coriolis versicolor. So we carry that in our clinic. Maitake mushroom is another one.
Maitake mushroom.
Yeah, maitake, reishi, those are all really exciting mushrooms. And this formula is called 5 mushroom formula, and it's one that can be helpful.
What about a rendered down cannabis?
Yeah, that's being used by a lot of people as well.
It seems to be pretty successful.
Yeah, some people are getting some good results with that. Curcumin, we prescribe curcumin from turmeric for so many things. We've talked a bit about that already. It can reduce tumor growth, angiogenesis, and can reduce metastasis as well. Now, I prescribe curcumin for all sorts of things. I even prescribe it for osteoarthritis, right, for knee pain. Ashwagandha is an Ayurvedic herb, which is excellent, and I use that one for hypothyroidism or for adrenal fatigue as well. So many of these herbs have additional uses. Whenever I'm developing an individualized treatment plan for someone, I'm often trying to, if I can address 2 of their health concerns with one herb, then I'm quite happy with that, right? Because sometimes it can get a little onerous when you're trying to add all these things into your diet and take these supplements. Milk thistle, I'm sure many of you have heard of that. It's used in a lot of detoxification protocols. It's very good for the liver. And then we talked about mushrooms already. Okay, so mistletoe is very interesting. So there's a company called Helixor. So that's, for all of you taking notes, that's Helixor. And they're a company out of Germany. They're actually a not-for-profit company, which I was really pleasantly surprised to find that out. So any profits they make from selling their mistletoe product gets invested into cancer research and researching the effects of mistletoe. Now, from a research perspective, there's a huge body of research. There's a large body of research about Helixor mistletoe in particular. But then if you're doing a PubMed search, so PubMed is a huge database of all the medical publications, then if you research mistletoe, there's even a larger body of research. So this isn't new. It's new at our clinic. So in Germany, medical doctors, their scope of practice is larger than the scope of practice of medical doctors here. So it overlaps somewhat with what my scope would be as a naturopathic doctor. For example, medical doctors in Germany, they do intravenous vitamin C, as well as sometimes chemo, radiation, surgery. But 50 to 70% of all people diagnosed with cancer in Germany are prescribed mistletoe by their medical doctors. So I find that really interesting, right? Because medicine has a lot to do with politics and culture as well, right? So mistletoe is administered sub-Q, so subcutaneous, so it's just under the skin, 3 times a week. The patient does this at home after being trained by their medical doctor or naturopathic doctor. So these are some of the effects of mistletoe. So, sorry, there's a lot of like medical jargon in here. If you have specific questions, let me know. Basically, cytotoxic just means cell killing. Obviously, in this case, we're looking at killing of cancer cells. So direct killing of cancer cells via induction of apoptosis. Remember I talked about apoptosis as cellular suicide. And then inhibition of protein synthesis, so basically shutting down the way that cancer cell proliferates. So the clinical effects, so what you would actually see in the doctor's office is reduction in tumor growth. So you might see the tumor shrinking, for example. So the indirect cytotoxic effect is that the immune system is stimulated by mistletoe. So activation of NK cells. So NK stands for natural killer cells. Natural killer cells are very helpful. They sort of roam around the body via the bloodstream, and they clean up. They mark cancer cells for death. So, and then cytotoxic T cells are an important way to kill off cancer cells as well. So there's more information here about how mistletoe stimulates the immune system. And what you would see, the clinical effect is the most important thing here, right? That's what we're really interested in. You know, increased survival, increase in body temperature, which is interesting, and increase in immune defense. So almost like mimicking a fever, right? Because a fever is your immune system's way of trying to detox, right? Killing off debris, killing off viruses or bacteria. So having a slightly warmer body temperature can be beneficial for a lot of reasons. And so then here are some more effects of mistletoe. So this is interesting too, that using mistletoe can reduce side effects. So we're talking about chemotherapy here, and improve the tolerability of chemo. So yeah, certain chemotherapy drugs are very difficult to tolerate. And that's why people talk about chemotherapy as poison, because it's meant to kill off rapidly dividing cells, because the cancer cells are dividing rapidly. But we have all sorts of other cells in our body that are dividing rapidly. Hair cells, cells lining the gut, and so that's where you see, you know, the hair loss and the gastrointestinal effects. So many very painful and debilitating side effects from chemotherapy. So this is just one therapy that can help reduce that and keep the body strong enough to withstand the adverse effects of chemotherapy and let the chemotherapy do its job with the cancer cells. And there are neuroendocrine effects too. So I thought that was pretty neat, that actually improved mood is one of the outcomes of mistletoe, and reduction of tumor-related pain. This is a neat slide because it shows an actual picture of blood distribution. So these are blood cells looking at you know, blood vessels that are feeding a tumor. So this one here is before mistletoe was applied, and then here you can see there's just not as, it's not as lit up, right? There are fewer micro blood vessels that are now feeding that tumor, and that's at day 14 of mistletoe therapy, so it's only within 2 weeks. I failed to add in the other 2 slides, but there's another couple slides, one at day 28, and it shows even further reduction. So these are just some of the survival rates of groups that are using mistletoe, and then matched groups who are not using it. So survival time. So this one here is survival time in just under 10 years. So you'll see here that so the EKRS group, that's the group that is taking the mistletoe, and the Herdecki group is the general group that's not necessarily taking the mistletoe. So some of them are, there's not a huge effect, like you'll see with colorectal cancer, you got 58% in the mistletoe group who are, who have survival time, and then 49% in the non-mistletoe group. It's not a huge range. But then you look at something like lymphoma and leukemias, you've got a 70% survival rate as opposed to 18.6% survival rate. That's a pretty huge effect. Those are the kind of numbers that impress me and get me excited about a certain therapy. So yeah, as you can see, it differs depending on the type of cancer, but clearly its usefulness is well documented. And just so you know, the N, that's the sample size. So that's how many people were studied for each of the groups. Okay. So clinical nutrition. Vitamin D. We already talked quite a bit about vitamin D, and I sent around that little sheet of paper. Are we still sending that around? Good. So this is based on some research as well, that vitamin D is, so it's measured in nanograms per milliliter. So if you get your blood levels of vitamin D tested, that's what your lab report is going to show. If you want to get that tested through your medical doctor, it's $33 to get it tested. OHIP stopped covering it because everyone was coming back deficient in Ontario. So OHIP said, you know what? They said to the medical doctors, don't bother testing people, just make sure they're supplementing, and that'll be the end of it. So they will, OHIP will cover it if if there's a concern about rickets or osteomalacia, but other than that, you have to pay your $33 if you get it done to your medical doctor, or you can come get it done with us in office, and I think that this is a new one actually, so it's a point of care test, which means all I have to do is prick your finger and take a little blood sample on a blood spot card, and we mail it off to the lab in Alberta. So that's handy for patients of mine who are already there in the office, and they're like, sure, I'll just get that done here, and that way I can avoid waiting in line at Life Labs. So, but it can be done in either place. It's the same reading either way.
Is there a place where you can get your blood tested for various things, cholesterol and vitamin D and other things, besides going to the rigmarole, going to a doctor and all that, and waiting months and months for your results?
You can get it done through us. The unfortunate thing is we're not covered by OHIP, so there is a cost attached to it.
Yeah.
But as long as you.
I mean, the blood test costs so much, or each?
Yeah, the blood test.
You're checking for?
Well, it depends, right? There's different panels of blood tests that we might order. There might be specific individual ones we might want to add on. They all have different costs, and I have no idea why the costs differ so much. Some of them are $3, some of them are $80. I don't know why.
Well, if you can come up with a vending machine that tests your blood, you'll be a millionaire.
I know, that'd be nice. But we do have, even though there's cost attached to it, it's usually a faster turnaround time working with us, just because we have more availability right now. Okay, so yeah, these numbers though, like 43 nanograms per milliliter, that's not a difficult level of vitamin D to achieve. If you're supplementing at even 1,000 IU a day, you're probably at that level or higher. So yeah, these are just some basic numbers.
Anybody north of the 40th parallel should be taking vitamin D.
Absolutely. Was anyone listening to CBC radio this morning when they were talking about the increased incidence of rickets among Native children up north?
Mm-hmm.
Yeah, so that was really upsetting to hear. It reinforced in my mind the importance of vitamin D, but they're talking about, breastfed infants and how, they're at risk if the mothers are very vitamin D deficient. And so they're depending on the fact that, maybe there's some contact with a nurse or someone who can say, yes, you need vitamin D, and then also counting on that new mom taking the vitamin D or giving the vitamin D to her babies. I mean, you see in, you know, very sort of middle class and well-educated new mothers, everyone knows you give your baby vitamin D drops, and you're probably, you know, giving yourself those supplements, but it's very different in, you know, communities where there's, you know, poverty and lack of resources and also violence, right? There's a certain chaos that exists where maybe taking a supplement is not the highest thing on your priority list. But it is an important aspect of health, absolutely.
So does that mean that 77 population that has at least 40 nanograms, that population will have 77% less chance of cancer than?
Than someone who has, yeah, than a group that has lower levels.
Isn't that major significant? That's super major
Vitamin D
significant?
is really, really important.
Wow.
Yeah, and it's so important in other ways too. I mean, you look at, this is all epidemiology, right? Which, you know, if I had another lifetime, maybe I'd study epidemiology because it's very interesting, right? It's looking at the incidence and prevalence of diseases over geography and cultures and populations. And so you look at something even like MS, multiple sclerosis. Why is it only happening in like Canada and in other northern countries? It's happening in places where there's not a lot of sunlight or we're very far from the equator. So there is a connection with vitamin D. It's not an equal cause and effect. It's not saying vitamin D deficiency causes multiple sclerosis, but there's a connection there that's not fully understood.
Stimulated effect.
Yeah, and there are connections too between vitamin D deficiency and cancer that we don't fully understand yet as well. But we really cannot underestimate the importance of vitamin D. Yeah.
Is that true that old geezers like myself get no value from sunshine? You have to be doing supplemental?
Well, I wouldn't say there's no value from sunshine.
Very
I
little.
think
The body
sunshine-
doesn't absorb it apparently at my age.
Well, sunshine has a lot of value for other reasons, you know.
Naked. Then we get enough.
Pardon?
Gonna be totally naked.
She said, get naked right now.
It'll burn all your parts.
I don't think you can get enough.
Burn your
In
parts.
the summertime.
Yeah, that's the only
So
time
suntan
you get
lotion
enough.
on.
My sense is that vitamin D is so important that I do believe that everyone should be supplementing with it. Everyone in Thunder Bay.
That's the only way.
If you live in Cuba, you may not need to supplement, but with my patient base, all of whom are pretty much in Thunder Bay, I do believe that it's important for everyone to supplement, at least in the winter time.
Is pill form
So, yeah.
the best way to supplement
Pardon?
pill, like, to your vitamin D? Is pill form the
That's
best
what
way?
I recommend, just because then I have that peace of mind knowing that my patients are getting exactly what I
Yeah.
know they
Yeah.
need. So, because you do get different amounts from certain foods, and, you know, there are certain, you know, like milk can be vitamin D fortified, and, but there's usually not very much. And now the research is coming out showing that we need much higher amounts than we previously believed. You know, the recommended daily intake used to be 400 IU.
Yes.
Health Canada has now bumped that up to a whopping 800 IU.
Or more.
It's still very conservative, so I usually recommend around 2,000 IU for basic maintenance. Yes,
Okay, you mentioned sclerosis?
multiple sclerosis.
Multiple
I just
sclerosis,
mentioned
okay, now
MS.
ALS seems to be on the rise. I know so many people all of a sudden that have ALS, that's almost like a sclerosis type thing too, is it not?
That's
How
a
is that comparing,
neurodegenerative
how does
disorder.
these diseases compare here to other places in the world? Do you have any
Again, that's
information
a
on that?
question for an epidemiologist, so I wish we had one with us tonight, because that stuff's fascinating, and looking at epidemiology does give us clues as to what potentially could be causing these conditions, right? You know, is it lack of sunlight? Is it toxins in the earth or in a certain industry in that country or that area? I mean, there's so many different things that you would need to look at, right? So maybe next time I'll do an ALS presentation.
So what's a bad guy in the diet? Like, what's the worst thing? Is it sugar?
In terms
Is
of
it-
toxins or?
Yeah, like,
cigarette smoke is pretty bad.
No, but I mean, as far as diet goes, like what's it?
Oh, for diet?
Worse than they can take.
You know what though? This is the thing. There are things in our foods that are not supposed to be in our foods, right? Like,
Like, you know, like pesticides.
yeah, like pesticides or other
Herbicides.
toxins. Even like, you know, food being delivered to us or stored by us in plastic containers, and there being bisphenol A or other hormone disruptors. I mean, there are so many different toxins and chemicals in our environment now. It's really good to try to reduce our exposure to those as much as possible. I mean, that's just one more reason to eat a whole foods diet. You know, if you have kale that you're harvesting out of your own garden and you're bringing it into your house, that's very direct, right? That's very different than, you know, a can of something, or like, say, a fruit roll-up or something like that, which has been through so many different processes that, you know, what has it been exposed to, what's been added to it. There are things that our foods are exposed to that wouldn't necessarily be on the label at the very end, because they're technically not in the food, but maybe it was, you know,
Because of
a cleaner
process.
used in a piece of equipment that the food was processed on. I mean, there's so much out there now, and so,
Processing includes the transportation of the food.
yeah,
By the time you get it on your table, it's already a month old. So there's basically not much in that food other than some minerals. Most of your vitamins, active enzymes, all those things that are supposed to be healthy for you, when you get it out of your garden and put it on your table, are absent in commercial food.
Plus
So
genetically
you might as well
modified.
just, you know, straw.
and I mean, it's wonderful when you can eat local. We don't have the option of always eating local in Thunder Bay. We just don't have a long enough growing season. I mean, there are some interesting initiatives that I really hope flourish, such as, you know, full year greenhouses where we can be extending our growing season, growing food all year round. We need to start thinking about this too, because the way that our food system is currently built is not going to be sustainable for
Preserving and
decades into the
processing.
future. And yeah, I mean, you look at the way that food was preserved and dealt with 60 years ago is very different than now, right? Our current systems are not sustainable, so. Anyway, that's a whole other presentation too. But it is interesting to really think about, you know, where our food comes from and try to eat as natural as possible. But I mean, that's just another reason to support our local farmers. You don't actually have to have your own garden. I wish I was a talented gardener. I unfortunately am not a very talented gardener, but I do like to, you know, go to the Thunder Bay Country Market every Saturday morning during the growing season. And it's nice to support those farmers because they work really hard.
growing or whatever.
Yeah, and Sleepy G Farms, they're going totally organic this year. So they've been organic in the past, but they're going officially organic now. So it's really exciting because they're leading the way here in Thunder Bay. So yeah, it's in everyone's best interest to support those farmers. Okay, so these are just a few of the supplements that I might prescribe for someone who's dealing with cancer. And there are so many different ones. These are just a few examples. We talked about fish oil already. EGCG, that is the short form for the potent antioxidant that's in green tea. What I recommend to people too is, you know, if you want to make your diet as anti-cancer as possible now, then, you know, drink a bit of green tea every day. If you're a caffeine drinker. If you can't tolerate caffeine, don't start.
White tea is supposed to be healthier than green tea.
White tea's great too.
In
Absolutely.
limitation.
Yeah.
There's an article in the paper today, some guy was drinking over a gallon of tea.
That's a lot.
He killed his kidneys.
Yeah, well, you know, everything in moderation too. You have to be
Moderation,
responsible
yeah.
about this. Quercetin is an excellent antioxidant. It's found naturally in apples and onions. Yeah, and it's actually used as a mast cell stabilizer too, so it can be used for its antihistamine properties as well. And I already mentioned glutamine as well, which is an amino acid, so it's a building block for protein, but it's the preferred fuel of the cells that line the digestive system. So it's good for like mouth sores. It's also good for helping to resolve diarrhea. And probiotics also really important for gut health. Yes, the good quality probiotics. So I just want to mention a bit about intravenous therapies. So this has been a passion of mine, a developing passion. We have a few different formulas. One of them is called the Myers Cocktail IV, and this has been around for decades. So I think someone was mentioning the research that was there in the 50s and 60s of Nobel Peace Prize winners, and that this stuff kind of gets lost in the shuffle. So same thing with Myers cocktails, they were used. And this is just, it's in 100 milliliters of saline, so that's not a very big IV bag. And contains magnesium, calcium, vitamin B5, B6, B complex, B12, and vitamin C. I do a lot of these and I'm getting some great results. I've had some patients say, I feel like the Energizer bunny after I get one of these. So I use it for, boosting energy, combating fatigue. It can also be used for like allergies and asthma as well, which I think is interesting. I haven't used it a lot for those things, but doesn't take very long to administer it. The appointment is an hour, but that's just to give us time to make sure you're all right, maybe check blood pressure, get the IV started. Once the IV started, it's 20 minutes. So that's just a bit about Myers cocktail. There's also an immune formula that I've administered, and interestingly enough, hydrochloric acid is the most important ingredient of that. Which, when I first read about it, I thought, what? Hydrochloric acid in your veins? Doesn't hydrochloric acid belong in your stomach? I mean, that's where it's naturally occurring, right? But the research for this and the practice of this goes way back to World War II, and it being administered, again, before antibiotics were commonly available. And what it does is it stimulates white blood cell production and stimulates the immune system. So I feel like this might be an emerging therapy as we go down the road of more and more antibiotic resistant microbes.
Does it chelate too? Like does it?
No, it's not a chelator. Unfortunately, I'm not allowed to do IV chelation, it's not within my scope of practice. It's strictly for boosting the immune system.
How come the chelation is off the list? Like I don't.
Talk to my board about that. It's like I said, medicine's very political. There are naturopathic doctors in
So
the
you're
US.
basically joining the medical system.
No, we're not. Our scope of practice is very different than medical doctors. Things are changing, and with our new, the proclamation of the Naturopathic Act, our scope of practice is going to remain pretty similar to what it is now. We are gaining a few things, so we are going to be able to prescribe bioidentical hormones, estrogen and progesterone. So our scope is expanding a little bit, and it'll probably expand more in the future, but first things first, right? So glutathione is another intravenous therapy that we do, and that's a really interesting one for neurodegenerative diseases such as Parkinson's. And that just has B vitamins and glutathione in it. It's an excellent way to actually get glutathione in because glutathione does not stay stable as an oral supplement, so it's very hard to get it in that way. That's why you're better off taking milk thistle as an oral therapy to help recycle glutathione within the liver, or getting the glutathione through IV. Okay, so now this is something that's really getting more and more research and more clinical application, mostly in big cities across North America. Right now, I'm the only one who's offering it in Thunder Bay, but high-dose intravenous vitamin C specifically for cancer. So the idea there is that, like I mentioned earlier this evening, cancer cells are preferentially trying to get glucose molecules from the blood. So they're greedily taking up as much glucose as they can. Now, vitamin C molecules look a lot like glucose molecules, on a molecular level. So if you can get the vitamin C levels high enough in the bloodstream, those cancer cells will take in a lot of vitamin C, and they don't have the same enzymes that healthy cells have. So healthy cells, when they take in a lot of vitamin C, the enzymes break it down into hydrogen peroxide. So harmless byproduct. Cancer cells aren't able to break it down into hydrogen peroxide, so they burst. Now, the trick is you need to get vitamin C levels up high enough and try to keep them high. And the vitamin C levels, even through intravenous measures, aren't going to stay high forever. That vitamin C is, it's gone out of your system within 24 hours, right? Your kidneys filter it out, and you pee it out. But just getting the vitamin C levels up 2 or 3 times a week can be very beneficial, right, for some cell-killing effects. Also, the fact that healthy cells are breaking it down and creating hydrogen peroxide, what that does too is it creates a pro-oxidant environment. So that contributes to some cancer cell death too. So it's a very interesting therapy because it can help beat back some cancer cells, and also it can be a nutrient for other cells too. So it doesn't have the same adverse effects that chemotherapy does. In fact, it's safe to use in conjunction with chemotherapy and can actually reduce the side effects. So, yeah.
Outside of cancer, vitamin C, there's this controversy about vitamin C and lysine. What's that about? You know anything about that?
Well, you're talking about Dr. Gifford Jones and his columns.
Yeah.
I don't know. I only prescribe lysine. The main way I prescribe it is to reduce cold sore outbreaks. So I'm sure there's other applications and other research. I mean, there's so much information out there. I'm not aware of all of it. Vitamin C is an important antioxidant, but it's not a cure-all by any means.
It's the lysine part that he's really got the world kind of.
Yeah, I don't know. Yeah.
What does
I
he
wish I
say
had
about
more to say
vitamin-
about that.
He said lysine.
Lysine, oh, yeah.
With vitamin C supposed
Yeah.
to.
Yeah, well, I take his concoction every day.
Yeah,
Hey?
the doctor in Germany, the one that was using baking soda, he was heavy on the vitamin C. He was doing heavy vitamin C injections. And he says, in the same thing, it's going with the mindfulness too. He says, you carry a lot of baggage. Lots of times your partner is the one that's causing your cancer in lots of cases.
And me, yeah.
Yeah, and he says, but it's heavy with, it's a baking soda. If you just type in baking soda cures for cancer, this doctor wrote all kinds of books, and he's using that. He says the tumors just go away if you treat the body, but whatever.
Any questions about intravenous vitamin C?
Yeah, I'd like to know, how often do you have to take it?
Twice a week is what I recommend.
And
That's what
ongoing twice a week forever?
Not forever, no. The protocol that I usually recommend is that we start with a modest dose of vitamin C. Well, first there's blood work to be done, right? I have to make sure that I get blood work on kidney function because we are putting a lot of fluid into the veins. I have to make sure the kidneys are up to the job of filtering that out, making sure the liver is okay, liver enzymes are all right, and most importantly, G6PD deficiency. So that's an enzyme that has to be working properly. So there's a rare disorder called G6PD deficiency that if you have that, high dose vitamin C can cause red blood cells to burst. So if I don't screen people for that, and somebody has that, I could kill them with intravenous vitamin C. So I don't want to kill my patients. I take them very seriously. So everyone does the blood work. And so once that blood work is done, we then start on twice a week intravenous vitamin C. So we might start at 20 grams of vitamin C. And we test the blood levels of vitamin C after the IV. And the way we do this is by using a glucometer. So anyone here dealing with diabetes and testing their blood sugar? So that's just using a glucometer that anyone with diabetes would use, right? So we prick the finger, figure out what the baseline blood sugar is. And then after doing the intravenous vitamin C, we prick the finger and check the blood sugar again. At that point, it's not just blood sugar, it's blood sugar plus the serum vitamin C level. Because, like I said, the vitamin C molecule and the glucose molecule look so much alike, the glucometer can't tell the difference. So it's handy because I can do that test right there in the clinic through a fairly inexpensive instrument like the glucometer. So then what we're looking for is an optimal blood vitamin C level. And once we hit that, for you personally, we stay at that level for 15 weeks. So it's not forever, but it is 15 weeks. So it is an investment of time and money. And so people are in every Monday morning, every Thursday morning for 15 weeks. And you know, we make it comfortable. There's plants, and we try to make the lighting comfortable. And I have to have the bright fluorescent lights on for putting in the IV, so that's what I'm doing. But then we put the lights on a little.
What does it
more
cost
reasonable.
per injection?
So the price goes up depending on how much vitamin C is used, because some people hit their optimal dose at 55 grams of vitamin C. Other people might not hit their optimal dose until 90 grams or even 100 grams of vitamin C. It really depends. So usually it's in and around 156 for people, $156 per treatment. For about, I don't know, 60, 70 grams of vitamin C. So like I said, it's a financial investment too, because, you know, if you're looking at $156 twice a week, 15 weeks, it definitely adds up. But people have been very happy with this therapy. And then after the 15 weeks, well, what do you do then, right? So after that, a maintenance dose is recommended. So, what I recommend is 1 IV per month, 50 grams vitamin C each IV.
And why are these people getting it done?
To help fight the cancer that they're
Cancer?
dealing with.
Oh.
Yeah. It's
What if you
specifically
don't
for
have cancer?
I
Should you do it?
No, I don't think so. It's a fairly invasive and expensive therapy, and
Yeah.
so personally, I wouldn't be doing it unless I had cancer. If I did have a cancer diagnosis, I would definitely be doing it.
Yeah.
Just take supplemental vitamins, maintain health.
Pardon?
Just take your supplements to maintain your.
Well, yeah, and everything else that we talked about, where we talked about exercise and eating a whole foods diet, drinking green tea, and I mean, there's so many things that you can do to prevent cancer already. I don't think intravenous vitamin C is necessarily something to do as prevention.
Well, and what about Dr. Jones there? I mean, he talks you should take a minimum of 3,000 milligrams a day of vitamin C.
It's not going to harm you.
That's my take.
That's what I take.
Yeah, I mean, it's not going to harm you.
Well, I've been trying to get
Doing
it
it for
down.
years?
I get 2,000 down usually.
Well, that's good.
Yeah,
That's
well,
good.
we talk about bowel tolerance, right? Because
Oh, yeah.
the problem with taking vitamin C orally is you will get diarrhea if you go high enough in dosing. So with intravenous vitamin C, you don't have that problem because you're bypassing the digestive system, right? So you can get to much, much higher levels.
It's very individual.
Yeah,
Some
it is
people
very
can handle
individual.
it.
We did a little poll once in one of our clinical nutrition courses in Naturopathic College where it said, okay, so most of us had tried, right, to see how high we could get with our oral dosing of vitamin C before hitting bowel tolerance. So for some people, you know, 3,000 milligrams, for just 3 grams. Other people were able to get up to 8 grams or even 10 grams without getting diarrhea. So it
Depends on
depends.
whether you're sick or not.
Yeah, exactly, like your body's utilization of vitamin C. So the best sources of vitamin C are lots and lots of fruits and vegetables, but there's no harm in supplementing with some extra
Yeah,
vitamin C
but
as
how
well.
long are you on the route to get here? Do you still contain
This is-
any vitamins?
This is the thing, I know we've talked a bit about, you know, our food sources and, you know, what's left in terms of fruits and vegetables that are trucked in from other countries. The fact is they still have benefit. It's better than not eating fruits and vegetables at all.
I say your best benefit is from your flash frozen basic vegetables because they seal in the nutrients so they don't lose them during transportation.
Yeah. But don't ever avoid vegetables just because you're worried about pesticides or you're worried that they don't have enough nutrients.
GMO
Vegetables that are subpar are better than no vegetables at all.
Yeah, but as long as you wash them, there's the vinegar solution and soak them a little bit, not cut them and then soak.
It depends on the vegetables too. I mean, it's worth looking on the Environmental Working Group website, which is ewg.org, I think, because they have the Dirty Dozen list. So looking at the fruits and vegetables that have the highest pesticide content, those are the ones that it's good to focus on organic. But, the research is not bearing out in terms of organic vegetables and fruits being better for health than conventional. The research hasn't actually proven that. So the moral of the story is just eat those fruits and vegetables. Don't worry too much about it. I do remember sitting in on an intake appointment with a woman who had cancer, and this was at the Ottawa Integrative Cancer Center. And the naturopathic doctor asking her about her diet, and she had not been eating any fresh fruits and vegetables because she was so worried about pesticides. She just hadn't been eating any fresh fruits or vegetables. She'd only been eating them out of cans because she thought that was safer. So that's just that's a word of warning, is sometimes when we start talking about all of these political things, like, our food sources, we can just become so overwrought with fear and anxiety that we're causing ourselves more harm. So go out there and eat your fruits and vegetables.
Grow a garden.
Yes, grow a garden if you can. If not, go to the market and buy vegetables from our local farmers. So that's the last slide I had tonight. Does anyone have any other
I
questions?
just have one thing, I don't want to monopolize this evening here, but I want one question answered. Can you get ozone therapy in Thunder Bay?
We're not offering that right now, no.
Go to Cuba.
Any other questions? Yes.
In the Alive magazine, this was a couple of years ago maybe, but there's a lady on TV, she does the announcing on the news, and she did a study because she had breast cancer, and she ate well, she exercised well, she did all the things that people tell you to do to stay healthy, and she still got breast cancer. And she went, well, what the hell? What's that all about, right? So in her investigation, and it was printed in the Life magazine, it went from coast to coast, north and south, all age groups, all class groups. And they found that every individual in Canada, no matter where they come from or what class they're in, all were contaminated with over 50 to 60 chemicals, environmental chemicals, that were causing a lot of the problems that people see today.
Yeah.
So many of the chemicals come in your water, they come in your air, they come in your food,
Yeah.
they come in your material that you live with every
Yeah.
day,
Et cetera, et
paints
cetera.
on your walls.
Makeup.
Right, so unless you have some sort of system of compensating for that poisoning, you're inevitably going to have, like, if you keep rubbing your skin enough times, sooner or later, you're gonna get something on your skin, right? So you have to be able to compensate for
And
that.
we all have natural detoxification pathways in our bodies, and that's why it's important to make sure those pathways are functioning properly, right? And we're talking about all the ways we detox, right? Having at least one bowel movement per day, making sure you drink enough water and urinate regularly,
And you, like you say,
sweating, breathing, all of those detox pathways we were talking about. So that's really important. And I mean, a lot of people recommend doing 2 detoxes per year. Now, be careful about the detoxes you do. It's a good idea to come in and see a naturopathic doctor to do a detox that's appropriate for you. So beware of any sort of store-bought cleanse products, because a lot of them do have, say, herbal laxatives in them, which can be really unsafe for people. So yeah, come and see one of us, and we'll design you an individualized detoxification program. This is a good time of year to be thinking about that too, just because the weather's getting warmer and people are getting a bit more energy. And also, if you do an individualized detox with an ND, we're looking at not only foods or particular supplements that will help activate all the detox pathways, but we're also looking at reducing stress in your life, increasing exercise in a way that works for you. Because some people want to go to the gym, other people hate the gym, and they only want to be walking outdoors. And so it's that almost like coaching from a naturopathic doctor that helps you figure out the best plan for you. So
I know your high-dose intravenous was used many times after people come out from traumatic situations, like during the Second World War, where they were actually starved to death. They came out with all kinds of problems. My dad, one of them, and he had to take intravenous for calcium, because
yeah.
calcium was totally robbed out of his body. But I mean, other people have to take other things to help them come back to balance.
Yeah,
So it's a very old system, it's not nothing
Oh, yeah.
really super new.
direct delivery.
Direct delivery, yeah.
Absolutely. Yes.
John, I'd like to shift over, if you don't mind, with heart health and sugar. What is it that sugar does bad for the heart?
Well, sugar creates inflammation in the body, and so when you're looking at cardiovascular health, you're looking at the health primarily of the blood vessels. And so, yeah, you don't want inflammation of the blood vessels. So the other way that sugar can contribute to poor outcomes in cardiovascular health is by contributing to like dysregulated blood sugar and eventually diabetes. Because having diabetes is a huge risk factor for heart attack and stroke. So, I mean, I'm not talking about like having birthday cake once a month at a family member's birthday party. I'm talking about, you know, double and a Persian every single day and cake for dessert every night and granola bars and all these things that, you know, some of the things sugar is obvious and sometimes they're not obvious, right? But, you know, having a sweet treat now and then is not a big deal. It's just when it becomes, when a large portion of your calories are from refined sugar, that's when your whole physiology tends to be altered.
Fructose is the worst.
Any refined sugar, but yeah, fructose is an example of refined sugar.
Because where it comes from
Yeah.
corn which has been sprayed.
Well, there's a lot of reasons why we don't want to avoid that.
How about that? What if you had too much natural sugars and you ate, say, more fruit than vegetables, like 70-30?
Yeah, you know, that's a good question. Vegetables are better because they don't
Yeah.
have as much sugar in them.
Yeah.
So what I usually, there are certain fruits that I do recommend certain people avoid. So
Okay.
for example, if you're diabetic, you probably don't want to have bananas.
Yeah.
Because bananas are really rapidly metabolized sugars, right? So it really depends. Berries can be much safer. The fruit, the sugar from the berries is not as rapidly metabolized. But one way to balance that out is to make sure there's a protein source in those fruit. So for example, talking about making a fruit smoothie in the morning. Some people are like, oh yeah, make my fruit smoothie and it's got these fruits and that fruit and I blend it with orange juice. And I'm like, okay, that's not enough. You need protein in there, right?
Yeah.
So I'm recommending like a tablespoon or two of flaxseed in there, which we
Right.
talked about flaxseed, the benefits there.
Yeah.
I recommend usually a protein powder, something like a hemp protein powder, rice protein powder in with the smoothies. For anyone who tolerates dairy products, adding yogurt, so that you have a balance, right? You've got your fruits in there, and then you've got some protein to help balance out
That slows
blood
it down.
sugar.
It slows it down.
Yeah, exactly, the absorption in your bloodstream. You want to avoid huge spikes and drops in blood sugar. That's what's causing havoc in your body. So you want protein and fiber in there, because protein and fiber help balance out blood sugar and, yeah, slow the absorption into the bloodstream. One more question, and then if people want to, they can individually chat with me. And also, feel free to book a free 10-minute consult with me at the clinic too, if you want to have a private conversation. So, yes?
Do you happen to know at what temperature cancer cells die in a petri dish?
Ooh, I don't know that offhand. That would be interesting to know.
Yeah, I'd like to know.
Yeah.
Isn't that 114, 112?
Fahrenheit?
I think so, yeah.
Probably hotter than we can
It's
get our bodies.
they said that the cancer cell, healthy cell dies at I think it's at 112. One of them dies at higher. Your good cells can take a higher temperature than the cancer cells. Apparently, it's a couple of degrees, but if you go a couple of degrees higher than that, you die. So
So you might make a case for regular saunas.
yeah.
Well, I mean, infrared saunas are a great strategy for detoxing because you are, with infrared especially, heating up layers of fat, and a lot of toxins are stored in fat, and, you know, sweating and getting those detox pathways open. It's just one way to help your body detoxify. All right, thank you everyone for coming tonight, for your great questions. And make sure you get a pamphlet on your way out.